Then we are deep fascia and going and hitting to the spinous process here. You can see the field, this is the spinous process. And close to the spinous process, I am just putting the knife and detaching the muscle. Then I am putting the knife inside. This is my Mayo scissor, I am spreading it. It is on the, I am hitting to the superior lamina, This is L4-L5, the lamina is the L4, okay. Then I am putting my periosteum elevator or maybe the chisel, just subperiosteally dissected the soft tissue, hardly once or twice. Now I am just putting a gauze piece. कितना मोटा कर and hitting to the again the superior lamina and going little cranially and caudally. So I got my space now. Yeah, upper lamina means superior lamina. This is L4 lamina. Then I am putting the gauze piece tied with a thread, sliding cranially tied with a thread and hooked to the hemostat. One more caudally. So now we got a space between the spinous process and muscles to dock my instrument. This is not going out. See this? This is locked. Once you go in, see my palm is holding here. My palm is holding here, holding the outer tube and then putting like this, to and fro movement. I am rolling over the lamina. So I can assess where is my lamina. This angle is my lamina. Then I am putting both the thumb, pushing down. It is locked on the lamina. Now it is released. Now it is over the, I am feeling the lamina again. So I am always putting the bone, never going beyond the bone. This amount of the little bit of the muscle with the soft tissue I am keeping for my future use. If I will having any dural tear, I may use this muscle. So it will be kept in the corner of the ruff. The muscle ruff in the corner. Okay, that muscle is preserved. Now these are the little bit of the fascia, muscles, soft tissue and cleaning. I will show you in 1 minute what I have cleaned. The cleaning is very important. If you clean properly, the visualization is very good. So ideal docking of the instrument is the cranial and caudal. Cranial half is the bone, caudal half is the ligamentum flavum or yellow ligament. One by one come here and see what I have done. The bone and the flavum.
Yes.
The cranial 50% is the bone, caudal 50% is the soft tissue or the ligamentum flavum. Bone, cranially, caudal is the flavum, yellow ligament. चश्मा दे दो सबको. चश्मा दे दो.
तुम्हारे किधर है?
वो ठीक है.
कॉम्पैक्ट हार्ड बोन नहीं है.
ये inferior lamina. Matthew, Vivek, this is inferior lamina. So what I am doing now? This is the superficial layer of ligamentum flavum. So I am just removing the superficial layer of ligamentum flavum. Now see, this is the beautiful anatomy you will not never see anywhere in the world. This is the superficial layer which has come superior to the inferior lamina. The superficial layer of the ligamentum flavum is superior to the, means dorsal to the inferior lamina. If I am removing this, the inferior lamina is visible. See, now see this? Okay. Now this is the superficial layer. Once you remove the superficial layer, this is the superficial layer I am removing now. This is the superficial layer I have removed. Okay? Clear now? Any doubt?
Very clear.
Yes. Now the bone is visible. Okay?
Inferior lamina.
That is the inferior lamina. So once you remove the superficial layer, you see the junctions of the deep layer and the attachment where it is attached to the inferior lamina. Where it is attached at the superior border of the inferior lamina. But in the superiorly, I remove a bit of vein to detach. Inferiorly, no need to remove the bone because it attached at the superior border only. See this? Okay. So these are also superficial layer. I have removed. Now put a petty.
The superiorly the attachment of the both the superficial deep are the same.
Sorry.
Superiorly the attachment of the ligament.
Same, but superiorly
deep.
No, superiorly it is not attached. Both has gone to the inferior or under surface or to the superior lamina. It is not superficial. Only inferiorly it is superficial.
It is antero-inferior.
So I am putting the petty now. Okay. So protected the dura. Now this is my ligamentum flavum. Okay. Now this is the two-way. This is the standard technique I am telling you, not my technique. The standard technique is this: putting a petty, then 90-degree Carisian punch to detach the ligamentum flavum. 90 degree. This is 90 degree. Till now I was using the 45 degree. This is the 90 degree I am using. This is the standard. You should do it. This is the standard. But for me is different. I am not going in the step by step. I am sometime what I am doing 45 degrees. So this I am doing. I am going directly here and feeling the. That is the. I am feeling that is the inferior lamina. Okay. Now see this. I am going directly and creating a space here and then removing. So now it is detached.
Inferior lamina.
Inferior lamina.
Superior border.
This is my standard, Ruida's standard, but not for you. Not for you. Now it is detached. But for you, you detach this for 90 degree. Then you remove the piecemeal. How you do this? You hold it Then lift, see the base there is a dura is visible, no adherent, cut it 90 degree. This is 90 degree, very sharp. Hold, cut. Hold, pull, cut. Hold, pull, cut. Okay. So this is a piecemeal removal of the ligamentum flavum with 90 degree Caresian punch. Hold, pull and cut. And come up to the hold, pull and cut. Hold, pull and cut. Hold, pull and cut. This is for you at least for 50 to 100 case. Hold, pull and cut. Hold, pull and cut. So gradually, maybe you will take 2-3 minutes, 4 minutes, then you are here. This. So once you will get a cleavage here and a space here, immediately put a patty. Don't take time. Immediately, because maybe one bite also may injure the dura. So you are putting a patty, protected the dura now. 45.
So now the patty was kept deep to the flavum.
Yes, it is to protect the dura. So dura is protected now. Okay. Now my left hand is also sometimes working like this. See this?
So,
See this? So now this is the SAP. This is the superior articular process. You have to remove this. My patty is protected. My patty is protecting to the dura. And I am at the foramen, foraminotomy. I am at the foramen. Okay. My patty is protecting. I am removing the and cleaning that foraminal area.
sir, it is a superior facet of inferior vertebra.
Very good. That is a superior facet of the inferior vertebra. So this is called SAP.
SAP.
The inferior facet of the superior vertebra is here. So now I am going to that. This first. Now this is always I am giving a protection. This is a demonstration, so you should. I am following the every steps, regular step what we are following regularly for the beginners, not for the me, but you should follow all the steps. Then you try to identify here the nerve root.
So, we have already removed part of it, inferior facet.
This one inferior facet. This is inferior facet. This is superior facet.
Facet.
This is the lamina. We have not removed the inferior facet. This is the lamina. This is the superior. This is the midline and lateral aspect of the lamina, and this is the inferior facet here.
Underneath the section is the inferior part of the
Facet.
facet of the superior lamina.
Superior lamina. So superior vertebra, inferior facet, inferior vertebra, superior facet,
Correct.
and this is the nerve root here. See this nerve root?
Yes, sir. Traversing root.
Yes. This is the nerve root. This is the foramen. Now I have to remove this one. So once you diagnose or identify the nerve root, you are
Sir,
tension free.
what is this structure?
This one is ligamentum flavum.
Part of ligament.
Ah,
Lateral one.
Lateral part of ligament.
yeah, it is attached to the facet.
He is using only one Caresian punch. You don't have to do multiple Caresian punches.
disc. Now I like to remove this one already soiled. So remove a bit of the fat. Now you can see this is the bleeding. I just knowingly injured that vessel. So this is the epidural vessels.
Underneath it is.
Yeah, this is the below is the disc.
That is the
That is the vessel. I injured that so that you can see how to manage the bleeding. See this. I am putting the new gauze piece and pushing it little bit cranially at the shoulder of the nerve root. Now this is the disc. Now I can dissect a bit of the soft tissue here, either with the spatula or maybe use the cautery here. Okay, half petty.
nerve root is नीचे.
No, nerve root is
This
here.
one is the nerve root.
This is
Here
the
on the axilla. And the bleeding is on the shoulder.
this is the axilla.
Axilla.
This is the dura. Okay,
Yes.
I do not want to remove this part. This is the dura here, and this is the nerve root. This is the axilla. This is the shoulder.
Shoulder. So the bleeding around the shoulder.
Yes, very nice. So what I am doing, putting a small gauze piece here, petty. Okay, pushing the nerve root little bit medially. I am getting a space to put my kerison here. Kerison, 45.
This is the balls piece.
Balls here I can remove, but still I do not. I want to remove this one, so that the nerve root will be completely decompressed. See this.
This is
This is the
Flavum.
SAP. Yes, this is the SAP. Yes,
SAP and some phlegm is also attached to it.
yes. They attach flavum along with the SAP.
We are not doing inferior articular pressure.
This is not inferior. This is
No, we are
superior. Inferior is here.
We are not removing in this.
Yeah, inferiorly may not touch also.
interior part you are removed. When you are
Already
under the
partly here we have removed. This is the inferior part of the inferior articular process. This is superior articular process. The joint line is here. Yes, that is the part of SAP means it we are doing proper foraminotomy and we are following the nerve root, decompressing the nerve
Decompressing
root
the root.
up to the foramen. This is the foramen. Okay, clear?
Foraminotomy is complete.
Complete. Complete. How much you can remove in stenosis case or little more, that is the depends on you. Done? Spatula. So this is the nerve root. Okay? This is the foramen. Now I will put the nerve root anterior to the nerve root. Put this gauze piece or this is the neuropathy. See?
So the bleeding stopped by tamponade effect.
Yes. Now you can use the cautery. Cautery भी you can use. मैंने इंजूर किया, उसको कॉटराइज करता हूँ बीमार.
It is bipolar, standard bipolar.
नहीं ऐसे करेगा. अरे कहीं नहीं है टी.
Sir, foot rest
गोड़ोटा
actually
खेचू ची 3 थर 4 थर.
Sir, आपन left foot pagra foot rest.
No, that is drill. Drill I use. He used the bipolar. But okay.
ये हम इसको कट करने के लिए
देखो देखो
Bleeding.
ये ब्लीडिंग तो नहीं है, जस्ट आई वांटेड टू शो यू, दैट्स व्हाई आई यूज्ड. देयर इज नो ब्लीडिंग. देन दिस इज द nerve root retractor. I am hooking it, the nerve root, and pushing medially. Okay, spatula. Now there is little soft tissue over the disc. This is a hard disc.
that is osteophyte.
This is the osteophyte. This is the almost hard disc. Ra. There. Now I am putting knife. See? Yes. This is hard.
नाइफ अलग है,
This is 11 number.
इसमें चला जाता है, टोटल में चला जाता है.
Okay,
पोर्टल के थ्रू डाला सर ये?
वही पोर्टल का थ्रू everything inside the portal. 49 knife.
Right
Knife.
part में तो
इसका
Now I am going to
handle
do
पतला
you.
होगा फिर।
This is the daring step, very daring step. I use this crossway. See this? My knife is towards the nerve root. Never. Even Rohidas also don't do this. I do. Don't take this risk for me. Initial phase. So this is the disc. 45 degree, 2 mm. Because this is a calcified one, so I am using.
Take Harrison punch and remove it.
So this is the Kerrison punch and 2 mm. If you take the bite like this, may injure the nerve root. So always reverse way, because the direction of the nerve root is this way. So always put in the reverse way, so that this is the safest side. You can remove this bone. Remove this bone hard disc. The annulus is calcified.
एक ही यूज कर सकते हो।
So-
10 क्यों चाहिए? तुम्हारी इंस्ट्रूमेंट कंपनी है तो 10 बना।
So this is my Kerrison punch 2 mm, and I am removing the annulus here, the calcified one, everything through the port, and I am not looking to the port. I am always looking, my vision is on the TV. My assistant is doing everything, he is putting the instrument into the port. Okay. Now again the disc force have come to my play. Still there is some hard disk here, so I just wanted to mobilize that. Put 2 mm.
रिट्रैक्ट करके करो, रिट्रैक्ट पर लगा के।
So this is my normal retractor again, 2 mm please. Once you are retracting, don't move, it is a fixed unit now. Don't move, this is a fixed unit. If you move, you may injure the nerve root. Once you are using the normal retractor, this is a fixed unit now. Don't move. I am fixed everything, my left hand, right hand, everything is fixed now. Yes. So that projected, elevated, calcified annulus is removed now. This is all Kerrison I am using, 2 mm Kerrison disc. Yes. So that is the cause of the pain. I am going to the center. This is the central part of the disc. I am just tilting. You can see my left hand. I am tilting a bit and going to the center. Now I am reversing my disc forceps. See this? I am reversing, opening towards me, and going to the foramen. This is the foramen. So one instrument, just reverse it. This is all foramen. You can, if there is a foraminal disc, you can cut little bit more here the annulus and go to the more laterally and directly to the foramen also. Here there is no foraminal disc, otherwise you will cut little bit annulus here and go to the foramen. So here no need. Now again I am changing. Foraminal disc is removed. I am trying if there is any left out disc close to the annulus here and close to the end plate here. Both side end plate I am filling. Even you can see inside also. This is the central part of the disc. Now before cleaning I can go inside. You can go inside the disc space and see is there any free fragment left out or not. Clean करो.
ओके सही किया.
ये पोर्ट का अंदर डाल दिया. I introduced through the port, through the operating chip.
अच्छा हाँ देखिए.
उसका अंदर डाल दिया
हाँ हाँ हाँ.
and going inside.
Yes yes.
Okay, and see the disc space here. Okay. So it is clear. There is no more
Clear,
free fragment.
Very clear.
There is no more free fragment. Now you can stop. So this is the end of the surgery.
Thank you, sir.
इरिगेट करना है?
अभी करेंगे irrigate.
हाँ?
अभी करेंगे irrigate.
इरिगेट
Disc.
से हाइग्रोस्कोपी बड़ा सिस्टम.
Disc.
हाँ?
सिस्ट हाइग्रोस्कोपी करता है, बाहर आ जाता है. इरिगेट कैसे करते हैं? सीधे से डाला,
To the working channel.
पर्की से डाला, ऐसे सब कर दो.
To remove the loose pieces.
हाँ हाँ yes.
So once if there will be
तो
any
सिस्ट इज हाइग्रोस्कोपी.
हाँ?
सिस्ट हाइग्रोस्कोपी होता है. तो थोड़ा इरिगेट करते हो फूल के आ जाता है.
कहाँ का सिस्ट?
नहीं सिस्ट नहीं होता है, डिस्क. डिस्क की हाइग्रोस्कोपी. सलाइन डालने से वो सोलह को भी बाहर आ जाता है.
saline. Now we will irrigate the space with the normal saline and gentamicin with the trifine. This is called trifine.
इसके थ्रू चला जाता है.
See this. So whatever the small fragment left out, it will automatically with the pressure of the saline would come out. Even the big piece also sometimes if there is a left out, you may not diagnose it, sometimes it coming with the pressure of the saline. At the same time, we have given the gentamicin inside. Okay. फोटो यूट्यूब चल रहा है. हाँ ओके. लाइट ऑन करो और दो चार फोटो खींचो. लाइट ऑन करो, फोटो खींचो. So cleaning with the gentamicin and the normal saline. If the bony debris, everything is clean now. फोटो
तुम डालते हो?
डालता हूँ 1 सेकेंड. हाँ इधर के सब कर्नर ने चारिपटर ने फटाफट ने फोटो चारिपट ने फोटो स्टिल